This is David Yang, a student at Western University. About 15 years ago, he was diagnosed with type 1 diabetes. Type 1 diabetes is a condition in which special beta cells of the pancreas, an organ located behind the lower part of your stomach, produces little to no insulin. Insulin is a hormone that helps transport glucose into cells where it gets stored for later usage. Without sufficient insulin, the body is unable to use glucose for energy, causing glucose to accumulate in the bloodstream instead of going into the cells. This explains why an individual with diabetes often have high blood sugar levels.
Hi, my name is David Yang, and I've been diagnosed with type 1 diabetes 10 years ago. As a freshman, I was trying to gain weight for the football team, so I ate breakfast, lunch, and dinner, and fourth meal. But I kept on losing weight. I was always hungry, so I was always eating, and I felt really tired. I now used to go to the restroom like 10 times a day, had headaches and shakiness. Eventually, when I had vision problems, I told my mom, and my mom took me to the physician, and I was diagnosed with type 1 diabetes.
Type 1 diabetes is usually diagnosed in children or young adults up to the age of 30. In order to diagnose an individual with diabetes type 1, a glycated hemoglobin test, also known as the A1C test, is taken. This test indicates the average blood sugar level of the patient for the past 3 months. Individuals who have an A1C reading of less than 5.7% would be considered normal. Those with 5.7 to 6.4% are at risk of having diabetes, and those with 6.5% or higher would be diagnosed with diabetes. Other tests that can be done include the random blood sugar test, the fasting blood sugar test, and the oral glucose tolerance test. If an individual is diagnosed with type 1 diabetes, it is very important for them to see their healthcare provider weekly, who will prescribe them with insulin so that they can monitor their daily intake of insulin and lower their blood sugar level. The most common treatment methods are injectable insulin pens, which are administered under the skin. Since an individual with type 1 diabetes cannot make their own insulin, these injectable pens will help them lower their blood sugar level. Some of the pens that are available today are Novolog, Lantus, and Humulog, all of which are 100 units per ml.
So I was diagnosed with type 1 diabetes, and from that experience I learned a lot of things. One of the most crucial things that I learned is to maintain my sugar level as part of my daily routine, and by doing so I'm able to prevent severe diseases such as heart disease, kidney damage, and other complications. With the knowledge that I receive from a healthcare provider, I'm able to use this knowledge to take control of my diabetes and live a healthy, normal life.